Hello, in this class we are going to learn about the septic shock. So we have learned about the classification of the shock, the most important type of shock, that is hemorrhagic shock, and in this chapter we are going to learn the septic shock, the clinical features, pathophysiology and the treatment of the septic shock. Let's start with the what are the etiological factors or organism responsible for the septic shock. The organisms can be gram positive organism or a gram negative organism. It could be due to fungal infection, or it could be due to viral infection, or it can be due to protozoal infection like a hydatid disease or a anaphylactic shock. So the septic shock can be classified depending on the organisms responsible for the shock. So this is classified as a gram positive septic shock or a gram negative septic shock. The gram positive septic shock is also known as the shock due to exotoxins. The exotoxins responsible for a gram positive shock, these are the Clostridium tetani, Clostridium welchii, Staphylococcus and the Streptococcus. There is a fluid loss and hypotension with normal cardiac output in case of a septic shock due to gram positive organisms. And the septic shock due to gram negative organisms, the shock is also known as endotoxic shock. These are the endogenous organism present in the body, that is in the urinary system, GIT, biliary tract or in the respiratory tract. The examples of the endotoxic shock are due to peritonitis, enterocutaneous fistula or due to pancreatitis. So this is the classification of the septic shock depending upon the type of the organisms are involved. So let's see the pathophysiology of a septic shock. So the entry of the organisms or toxin, or there is a translocation of the endotoxins from the GIT, urinary tract or from the respiratory tract into the systemic circulation, which the organisms could be E. coli or Klebsiella or Pseudomonas or a protease. It will causes the activation of the inflammatory response. The activation of the inflammatory response leading to the activation of the macrophages, activation of the neutrophils and the activation of the monocyte, which ultimately results in the release of the various number of cytokines and the free radicals. The free radicals and the cytokines will causes the chemotaxis of the cell. There is endothelial injury and there is a alteration in the coagulation cascades. The endothelial injury will lead to the endothelial gap junction formation, which causes loss of intravascular fluid into the tissues, and this response is mediated by the cytokines and the free radicals, is termed as a systemic inflammatory response syndrome. So what is systemic inflammatory response syndrome? It is a reversible hyperdynamic type of condition. It is a warm stage of a septic shock, which is characterized by fever, tachycardia and tachypnea. So if we have not treated the septic shock at this level, this may convert into the severe type of septic shock and will causes severe circulatory failure with multi-organ dysfunction syndrome and the DIC, that is disseminated intravascular coagulopathy. and ultimately will result into the hypodynamic irreversible. So up to the SIRS, it is a reversible stage of shock. After the multi-organ dysfunction syndrome and the DIC, the shock become irreversible, and this is going to be the cold stage of a septic shock. So remember the characteristic features of the SIRS is that we have already seen the SIRS in the case of a first module of the shock. So the component of SIRS are the increase in the heart rate more than 90 per minute, the increase in the TLC by 12,000, or can be fall in TLC less than 4,000, or increase in the respiratory rate, temperature more than 38 degrees Celsius, or temperature less than 36 degree Celsius. Any two or more than two of these component will result in the SIRS, that is systemic inflammatory response syndrome. So let's see the pathophysiology. Basically it is a toxin induced vasodilatation of the peripheral vessels. So the toxin induced, there is a nitric oxide synthetase release which causes increase in the nitric oxide which causes the vasodilatation. So this is going to be the pathophysiology of a septic shock. So basically it is a vasodilatory shock. There is a sustained high levels of nitric oxide which causes peripheral vasodilatation. So there is a pulling of the blood into the venous system. So actually the difference from the hypovolemic shock and the septic shock is that in case of a hypovolemic shock, the amount of blood is decreased in the intravascular component, but in case of a septic shock, the amount of blood is same as that of a normal body amount, but there is a decreased utilization of the blood at the tissue level, and there is a pulling of the blood into the intravascular component which result in the decreased utilization by the cell. So there is a peripheral pulling of the blood which ultimately result in the hypotension because of the decrease in the preload. Actually the preload is increased, but after the severe injury or severe toxin mediated vasodilatation, there could be the vasodilatation and the ultimately the hypotension. So the hypotension is resistant to the vasopressor agent because it is due to the hypertension is due to the vasodilatation which is toxin mediated. So the sepsis is a term which used when there is a presence of systemic inflammatory response syndrome in presence of a known infective foci. So what is sepsis? Sepsis is a combination of SIRS plus infective foci. So sepsis can be graded as a mild sepsis or severe sepsis. The septic shock. The mild sepsis is characterized by presence of fever, tachycardia and the leukocytosis. So basically mild sepsis is a form of a SIRS, systemic inflammatory response syndrome. In severe sepsis with presence of fever, tachycardia and leukocytosis, there is a additionally presence of a low tissue perfusion and the organ dysfunction with presence of lactic acidosis. So multi-organ dysfunction start to occur in case of a severe sepsis. So severe sepsis is a SIRS plus multiple organ dysfunction syndrome. So severe sepsis is a SIRS plus MODS. And in case of a septic shock is a combination of shock plus septicemia. So it is characterized by severe hypotension despite of a fluid therapy, multiple organ dysfunction syndrome. There is a maldistribution of the blood flow. There is a shunting of the microcirculation, which require the most important factor to diagnose septic shock is a requirement of the vasopressor and the presence of the lactic acidosis more than 2 millimole per liter. So this is the sepsis classification. Mild sepsis is a SIRS, severe sepsis is a SIRS plus multi-organ dysfunction syndrome, and the septic shock is a septicemia plus shock. So the septic shock could be, there are mainly two stages of a septic shock. The initial stage is a hyperdynamic stage of a septic shock, which is also known as warm shock, and the last decompensated stage is a hypodynamic stage of a shock, also known as a cold shock. So in case of a hyperdynamic or warm shock, it is a initial stage which is reversible. It is characterized by presence of fever, tachycardia, tachypnea, and there is a pyrogenic response, that is fever is there. There is a it is a reverse on the proper treatment, and it is treated with the higher antibiotic according to the blood culture, drainage of the pus, or if there is a presence of a intra-abdominal abscess, there could be the treated with the laparotomy, ICU care, correction of the coagulopathy, and may need a ventilatory support. So this is the initial stage of the septic shock, that is hyperdynamic stage, also known as warm type of shock, which is reversible type of shock. If the proper treatment is not given at the level of the hypodynamic or a warm shock, it will convert into the hypodynamic and a cold type of shock, which is irreversible type of shock, and there is a decrease in the TLC count. So the TLC count become less than 4,000. There is a, the pyrogenic response is lost, body's defense mechanism is lost. There is a decompensated type of shock, presence of multi-organ dysfunction syndrome, and there is a cardiac failure, ultimately lead to the coma and death of the patient. So this is the classification of the septic shock. One is hyperdynamic, that is warm type of shock. Another is a hypodynamic, that is cold type of shock. So what could be the treatment of the septic shock? So basically the septic shock is treated by the, first is a correction of the fluid and electrolyte. The treatment could be by infusion of the crystalloids, or if necessary blood transfusion can be given. So appropriate antibiotics are given. Generally third generation cephalosporin and aminoglycosides are required for the treatment of the septic shock, and treatment of the other factor like a source of infection could be treated with the drainage of the abscess, or a laparotomy for peritonitis, incision and drainage of the abscesses. There is a resection of the gangrenous bowel, or if there is a presence of a necrotic patch or a infected wound, they are treated with the wound debridement. And the pus, urine, blood, and the bile cultures and sensitivities sent, and the proper antibiotic are started depending upon the culture and sensitivity results. ICU care given to the patient with septic shock in the form of O2 support, ventilatory support, correction of the coagulopathy, and the vasopressors. So target of ICU care is that maintenance of the urine output and the blood pressure. So the shock patient is monitored with minimal monitoring. Consider it consists of monitoring of the ECG, pulse oximetry, blood pressure, and the urine output. Advanced monitoring is by CVP measurement, invasive BP, blood pressure measurement by arterial line insertion, or a cardiac output measurement, base deficit measurement, and the serum lactate. So for the measurement of the systemic or organ perfusion, this is the very important chart given in the Love and Bailey. So basically the most important clinical parameter for the evaluation of the perfusion is the urine output. Urine output is the most important clinical parameter for the adequate tissue perfusion or the resuscitation. But the best investigational parameter for the tissue perfusion is a serum lactate level. If the lactate level is less than 2, it means there is a good resuscitation. If the serum lactate is more than 5 milliequivalent, it means there is a bad prognosis, or the resuscitation is bad or inadequate. So another important factor is a mixed venous oxygen saturation. So we have already seen in case of difference between the hypovolemic shock and the septic shock. In case of a hypovolemic shock, the mixed venous oxygen saturation is less than 50%, but in case of a septic shock, the mixed venous oxygen saturation is more than 70%. So if the overall best parameter for the monitoring of shock is asked, it is the overall best parameter is the mixed venous oxygen saturation. Best parameter, best clinical parameter for the adequate resuscitation is a urine output, and the best parameter for the tissue perfusion is the serum lactate level. And the organ perfusion can be assessed by the, like muscle is assessed by the near infrared spectroscopy, tissue oxygen electrode. GIT is assessed by the sublingual capnometry, gut PIH, and the laser Doppler flowmetry. Kidney, brain is monitored by the tissue oxygen electrode and the near infrared spectroscopy. In GIT, remember that the gastric mucosa is more sensitive for the hypoxia, and the hypoperfusion will result into the formation of the stress ulcer in case of a shock. It could be due to burns, or it could be due to head injury. In burns, the gastric ulcer or stress ulcers are known as curling ulcers, and in case of a head injury, the stress gastric ulcers are known as a Cushing ulcers. So this could be the treatment of a septic shock. So there is another important features in the recent updates of a Love and Bailey, that is surviving sepsis bundle. So this could be the surviving sepsis bundle campaign. It consists of the 6 component, in which we have to take 3 from the patient, and we have to give 3 to the patient in initial stages of the resuscitation. Ideally it is done within initial 6 hours of the resuscitation. So we have to take three components, that is we have to take blood for culture, we have to take blood for the serum lactate level measurement, and we have to do the serum complete blood count, that is CBC, and we have to give the three component, that is IV fluid and the IV fluid, IV antibiotic, and the O2 and the urine output monitoring has to be done. So this is the component of the surviving sepsis bundle. So this is all about the septic shock. So let's see the basic difference between the hypovolemic shock, and the septic shock. So most important is the parameters which are important are pulse rate. So in case of hypovolemic shock as well as septic shock, there is a increase in the pulse rate, that is tachycardia is there in both type of a shock. So another component is a blood pressure. In case of a hypovolemic shock, the blood pressure is decreased. There is a fall in the BP, there is a low BP. In case of a septic shock, normally initially in a case of a warm type of shock, the blood pressure is initially increased and ultimately then fall during the hypodynamic state. This is for the cardiac output. So the cardiac output is decreased in case of a hypovolemic shock, but in case of a septic shock, initially cardiac output is increased in a warm type of shock, it is hyperdynamic state of a cold shock, septic shock, and ultimately it become cardiac output become low in case of a cold type of shock. So the blood pressure is decreased in both type of shock, but it can be normal or decreased in case of a septic shock. So the most important feature or a difference is peripheral vascular resistance. So in case of a hypovolemic shock, body tries to compensate the blood supply to the vital organ by causing vasoconstriction of the peripheral vessel. So there is a vasoconstriction at the peripheral vessel, which causes increase in the peripheral vascular resistance. Peripheral vascular resistance is increased. But in case of a septic shock, there is a toxin mediated peripheral vasodilatation, which causes decrease in the peripheral vascular resistance. Another most important difference in case of a hypovolemic shock and the septic shock is that mixed venous oxygen saturation. Normal mixed venous oxygen saturation is 15 to 70%. It is so what do you mean by mixed venous oxygen saturation? It is the percentage of saturation present in the returning blood towards the heart. So in case of a hypovolemic shock, the amount of blood is decreased. So tissue or cells are having craving for the oxygen. So as soon as the blood goes to the tissue or a cell, they try to absorb maximum amount of oxygen from the blood, and the returning blood has a less amount of oxygen saturation. So it could be a less than 50% in case of a hemorrhagic shock or a hypovolemic shock. But in case of a septic shock, there is a toxin mediated dilution, there is a toxin mediated vasodilatation, there is a septic foci at the septic focus, which causes derangement of the absorption or utilization of the oxygen at the cellular level. So the amount of blood returning towards the heart has an increased amount of oxygen saturation, because the blood returns unutilized towards the, so the mixed venous oxygen saturation in case of a septic shock is more than 70%. So it is a diagnostic of a septic shock. So these are the important features in case of a hypovolemic shock and the septic shock. So another important features can be the extremities are cold in case of a hypovolemic shock, but initial stage of a septic shock has a warm extremities because of the hyperdynamic circulation. So this is the difference between the hypovolemic shock and the septic shock. So this is all about the shock. So we have learned about the classification of the shock, hypovolemic shock and the septic shock. So on the septic shock there could be a LAQ could be asked in case of a university examination. This could be like define the shock, classify the shock, and write a note on the septic shock. Or there could be a SAQ on the SIRS and the septic shock. So thank you and all the best for the examination.